Well, good afternoon, and thank you for joining us for today's discussion entitled, How Has Your Province Handled the Pandemic? Hosted by the Macdonald-Laurier Institute. My name is Aaron Wudrick. I am the director of the Institute's Domestic Policy Program. Very pleased to be moderating today's event with our distinguished panelists, who I'll be introducing momentarily. The inspiration for the discussion today is the launch last month of MLI's Provincial COVID Misery Index, which was our attempt to try and quantify the full extent of the suffering of Canadians in various provinces throughout the COVID-19 pandemic by measuring not only what we call disease misery, such as deaths and case counts, but also what we've termed response misery, which measures such things as testing capacity, vaccinations, and lockdowns, and also economic misery, which measures such economic factors as unemployment, changes in gross domestic product, and government debt. And as MLI's rankings have shown from our index, some provinces have managed the pandemic much better than others. And generally speaking, the larger, wealthier provinces have suffered disproportionately from lockdowns, crumbling economies, and disease and death. And Ontario, in fact, is still quite tightly locked down. Although we did get word not a couple of hours ago that there will be an opening coming up on Friday, which is the first step back to normality. So we're quite happy about that here in Ontario. But to talk about the COVID response of governments today, we've assembled a panel of experts to reflect on the extent to which Canada and its provinces have created or prevented misery through their actions during the pandemic. And so we're pleased to be joined today by Dr. Jack Mintz, who's an MLI Distinguished Fellow and the President's Fellow at the School of Public Policy at the University of Calgary. Dr. Jennifer Grant, who is a medical microbiologist and infectious disease specialist serving as clinical associate professor at the Faculty of Medicine at the University of British Columbia and a medical director of Vancouver Coastal Health. And finally, Dr. Matt Strauss, who is an ICU physician, formerly the medical director of the ICU at Guelph General Hospital and now an assistant professor of medicine at Queen's University. Welcome to you all. I wanted to start today by asking maybe just for some general impressions from each of you, since you are all in different provinces, British Columbia, Alberta, and Ontario. To ask you something that you think your provincial government has done relatively well compared to other provinces, and then perhaps something that they've done relatively poorly compared to other provinces. And maybe we'll start on the West Coast for this one with Dr. Grant.
Hi, thanks very much for having me. So I'm going to start with the good news first. And I think that the thing that BC has done absolutely the best is a commitment to keep schools open and a commitment to prioritize children as a special population within the pandemic. This was, I think, based on a similar commitment to look at unintended consequences of lockdown. And when we closed schools briefly from March until June, there was a great deal of data generated looking at what was happening. And it was quite clear that closing schools was exceedingly harmful to children and had probably little to no benefit in terms of transmission. So that, I think, has been done really well. And they have committed and held strong despite quite substantial political pressure. In terms of things done less well, I think I want to sort of step back and say that I actually think that BC has had an incredibly rational approach. So I don't want to criticize my colleagues who've been working really hard under intense pressure. But I think that something that we did poorly and that everybody did poorly was stepping back from our existing pandemic plans. We had all conceived of a respiratory tract infection being a pandemic. This is nothing new. It's not unexpected. We had plans for this, and we had sat down with our ethicists, our economists. We thought through all of the different potential consequences, balancing health, economy, competing health interests in a framework that was ethical. And we, instead of following that, sort of fell into the panic and started locking things down without really understanding what the consequences of that were, and understanding what benefit, if any, was attributable to any of those actions.
Okay, thank you. Well, let's keep moving east. Next, going to Dr. Mintz.
Thank you very much. In a sense, actually, I've had kind of like two places that I've been living in, both Toronto and Alberta. In the case of Alberta, I've been chairing the Premier's Economic Recovery Council. So much of the work that I am particularly knowledgeable about with respect to what Alberta has done relative to other provinces has been in the economic side. Alberta was severely hit in terms of economics. It not only suffered from the lockdowns and that happened worldwide as well as in Alberta, where people were told to stay home. Exports fell, obviously, and also people traded less, and so there was a significant loss in working hours, and so it was a very, very tough time. But on top of it, Alberta had significantly falling oil prices, where many companies were really put into very severe difficulty, potentially going into bankruptcy, and many people getting laid off. And in fact, Alberta really did suffer the most in terms of loss of GDP, as the Macdonald-Laurier Institute misery index shows. But a lot of it were factors that it really couldn't control. So the bigger issue is, how do you think about giving hope to people during a very bad time? The province did move very quickly in trying to help the various sectors to make sure that they wouldn't suffer. I remember, one of the immediate things was to make sure people didn't lose their apartments or their homes, through evictions. The province immediately stopped that from happening. Of course, the federal money that came to people also helped make sure that people didn't suffer too much financially during the pandemic. And like the rest of the Canada, household incomes in the end went up during the pandemic and not down, which is quite unusual. But I think more important, one of the things that Alberta did do was introduce the first economic recovery plan in June. That was not written by our council; it was written by the federal government itself, by the province itself. But it did actually give an indication of how policy will evolve after or when the pandemic starts getting lifted, and people can get back to work. And there was a lot of emphasis on not just only rebuilding what is already working well in Alberta, but looking at new strategic sectors that could bring diversification to the province, as well as looking at some other factors such as childcare and other policies that could help get people back to work. And in fact, the whole emphasis of the recovery plan was to get people back to work and to get growth back to the economy. And today, Alberta is coming back really well. Part of it is because of factors it doesn't control. The price of oil is back to the pre-pandemic periods. There's a lot of cash coming into the province, but the agriculture sector is doing really well. And through government policies, actually, that were announced over this past year, the high-tech industry is really booming. In fact, I talked to some of the high-tech companies that have just moved to Calgary, and they are very interested in moving to Calgary because of the quality of the workforce, the large industrial sector that is available, and also policies like the low corporate income tax rate that was announced that is also helping draw companies in addition to any R&D tax credits, et cetera, that are being provided. So it is quite positive in that sense. But on the pandemic side, of course, Alberta suffered more in terms of deaths per capita, but we can get into that afterwards.
Great, thank you. And last but not least, Dr. Strauss.
I had to struggle with the first part. I think you said what our province did well, because I would really have to stretch to think of what our provincial government did well. What our province did well, I'm always humbled and impressed by the doctors and nurses and other healthcare professionals that I work with. The amount of work that they've done in the last 3 months, largely without complaining, has been terrific. I work in Kingston, among other places, and our ICU there more than doubled its capacity on very short notice. My impression was the whole thing ran like a clock. It was really impressive. Part of that was the provincial government's decision to start sending folks from overwhelmed GTA hospitals further afield, and in fact, as far as government programs go, that went really well. I thought that went very smoothly. My overwhelming concern in terms of what we did not do very well as a province and the provincial government is it just seems like concern for human rights has really gone on the back burner. And as a clinician who has been on the front line, what concerned me a great deal in the first wave was folks coming in with not COVID, but with diseases of, let's say, desperation or due to social isolation and neglect. So I have written about, and I've spoken in other fora about elders from nursing homes who have come in literally starving. And that's a difficult thing to quantify. How many elders starved in long-term care during that first wave it was not reported on CP24 breathlessly along with the number of COVID cases, but both of those incidents represented to me a tip of the iceberg, an absolute ocean of human suffering that was caused by the decision of, on provincial level as well as more local levels, to not allow families to see their loved ones. And that continues to be the case. So I recently looked after a man who had been 3 months in the hospital with COVID and not allowed to see his family at any point during that time. That affected me a lot. I recently looked after a woman who almost died peri-childbirth, and her life was saved. And I'm very grateful to my team. It's a long story, but because she was COVID positive and her baby was COVID positive and taken to a different hospital, and her husband was exposed, so ordered to quarantine, no parent was allowed to see that baby for 2 weeks. And I can go on and on with these lists of sort of what I have found to be Russian novel levels of inhumanity and suffering. But I think just the fact that human rights have value, that the way humans get value out of their lives is different from person to person. And the way that we respect these different values is by respecting folks' ability to make their own decisions and personal liberty and that sort of thing. So there still are nursing homes where folks have not been allowed to see their family for a year. And this is quite intolerable to me from a moral perspective.
Okay. Well, thank you for that. And I think you've really hit on something, that there are trade-offs involved here. That, when the governments take a lot of these very aggressive measures, there's collateral damage. And that's often not talked about. And I do want to get into that a little bit later as well. We are taking some questions from the audience as well, if you are watching. And one came up actually for Dr. Grant. I think it's a good time to pose it because you had just spoken off the top. And the question for you, Dr. Grant, was you had mentioned a plan that was in place that the government did not follow. And the question is about what was that plan? What would that plan have looked like if British Columbia had stuck to that plan?
Yeah, thank you so much for the question, Maggie. And so our pandemic plans are all up, and they're still up online, and you can read them word for word. But essentially, the plan prioritized a balanced health approach. So we know that when a pandemic comes, that the disease in question is the one that we're going to concentrate on, but we still need to consider the other health conditions associated with other people. So we actually closed down all of our hospitals to accommodate the rush of patients, which in the first wave actually didn't arrive, at least not in BC. They certainly did in Quebec. But I think the other thing is recognizing the importance of ordinary everyday life. So we sort of all, and across the board, this isn't just BC that did this, but across the board, we closed everything immediately, up to and including schools, which were explicitly expected to stay open during our pandemic plan. Keeping businesses open and keeping people's livelihoods alive, because we have to remember that health and wealth are actually the same thing, and people's hearts and souls are in their businesses. And when they lose them, it becomes a health issue. Because they are at risk for suicide, they're at risk for depression, they aren't going to be able to feed their kids, they end up in other health issues, and that can last for decades. And so trying to keep that balance going under severe pressure, because we do know, we see the threat in front of us as being the first and foremost, but we have to recognize that the other things that are being missed in terms of people not seeing their family doctor, people not being able to work, not being able to eat properly. We actually did have children come into our children's hospital starving. It's not just elders. So a lot of those community programs are dependent on people being able to move around and keeping essential services in the community open.
Okay, thank you for that. And speaking of shutting things down, lockdowns are of course a very contentious topic. The argument is that they have been necessary. We see that in different jurisdictions, their deployment has varied considerably. Some places have used lockdowns a lot, others have used them less. So, I wanted to talk both about the economic consequences. Maybe we'll start with that, Dr. Mintz. The economic consequences of the lockdowns. some people say that it's just unavoidable collateral damage, and if so, how is the economy, particularly in Alberta, managing through these lockdowns?
Well, first of all, I think this whole issue of lockdowns is going to be one that is going to spawn probably hundreds of, maybe thousands of PhD theses in the future, looking at whether we did the right thing, actually, in terms of our objective. Because we do have to remember there are trade-offs, and health authorities tend to be very focused on saving lives. And also they were very concerned about their hospitals being overrun and having to make decisions about who can live and who can die, which are very difficult things to do. But we also know that there are consequences, and I totally agree with Jennifer and Matt what they've been saying with respect to social and economic costs, not just economic but also social. And in my view, we really needed to look at what I would say is almost a matrix of different things, and make decisions that are based on trying to minimize social and economic costs as much as possible, and avoid lockdown consequences as much as possible. I should say that in Alberta, schools were, at least this past year, were open most of the time. There was only a short period that they were closed down. And I think that's similar to British Columbia, but here in Ontario, where my 6 grandkids are, they have been out of school most of the year, and I think that's going to have some very long run consequences, I think, for the population. Not in terms of loss in skills, which are going to have to be made up by, but also the way that kids are going to look at risk in the future. Are they going to be very scared of any type of risk that they're going to be facing that could actually have its own consequences as well? One of the big questions that many people have asked is whether the lockdowns actually help the economies rather than made them worse off. In fact, I remember people used to run, correlations between unemployment rates or GDP losses and some other factor, let's say like case rates per 100,000 population. So just before today, I decided it might be fun to sort of look at that. And so what I did is I actually looked at losses in GDP by province and death rates. In fact, I think death rates in the end is going to be the thing that people are going to objectively look at and say whether a province did well or not, is whether they had a high death rate or a low death rate. And as we know, Quebec actually had the worst one. So far, it's been 1,300 per 100,000 population, while the Atlantic provinces were very little. Prince Edward Island, I think, didn't have 1 death, but certainly in Newfoundland it was only 11 per 100,000, and Nova Scotia was 90, and New Brunswick was 56. Well, the bigger provinces had much higher death rates. On the other hand, when you actually look at the losses in GDP, the province that was worse off was Alberta, but it didn't have the worst death rate. That was Quebec, and in fact, Manitoba was higher than Alberta. And the lowest losses in GDP were in New Brunswick and in Quebec. So, actually, Nova Scotia actually had the lowest. So what I did is I ran just a correlation to see what was the correlation between losses in GDP and death rates per 100,000. And it almost came to 0. In fact, it was minus 5%, which means that there was very little relationship between the two. And that doesn't surprise me, because there's many factors that influence both statistics, including, how testing was done in the case of death rates. Did we try to minimize them? What was the capacity of hospitals? And other factors that could influence death rates, but also on the unemployment and GDP loss side, we also know that there are other factors like the resource economy and where the federal money went, et cetera, that could have an impact on GDP. So correlation to me is a coefficient is not very interesting, but it is something useful to say. At least we didn't see a big correlation between lockdowns and let's say lower losses in GDP. where those provinces like the Atlantic that had closed down quite a bit ended up with an advantageous loss in losses, economic losses. So in my view, we really need to look at this more carefully. I'm the view that we should have, I actually take a similar view that in the case of schools, they should have been broadly left open. In fact, we should have almost thought of them as essential businesses. We didn't close down grocery stores because of the pandemic, and we didn't close down drugstores either, and et cetera. But we did close down schools. And to me, that probably should have been one of the areas that we should have treated almost like an essential business. And then, of course, in the case of unessential businesses, maybe some of them didn't have to be locked down the way they did. In fact, it made absolutely no sense that Walmart could be open because they were selling some groceries but could sell everything. But then in a small rural town, a hardware store couldn't be open. That really didn't make sense to me. And so there were a lot of anomalies that happened. And as Matt pointed out, there was a lot of human rights issues involved. But I think those things are reflective of the fact that once you get into lockdowns, you can have some very punitive results that can really hurt people. And so when we come back to this down in the future, it'll be an interesting question to ask whether we should have done the lockdowns that we did, and whether we should have just rode through it. And I think at the beginning, a lot of the objective was to save hospitals from being overrun, which is why the lockdowns were done. But later on, it almost became, if there's still any potential cases of risks or a wave, that we would continue doing lockdowns. And I think the objectives and the goalposts kept changing at a later time.
Yeah, I think you're absolutely right on that, Dr. Mintz. That's something a lot of people have commented on, is that early on it was about flattening the curve. And now it seems that, if there are any instances at all, that seems to be the justification for the lockdowns. I'm interested to hear from, maybe we'll start with you, Dr. Strauss, and then go to Dr. Grant, because obviously Ontario and British Columbia have had very different experiences in terms of the use of lockdowns. And just your thoughts on, how the provincial governments in these two provinces have used that tool.
I've been a vocal opponent of lockdowns all along, and I think I don't want to. I like 99% of what Dr. Mintz had said, but I think one thing I want to point out is, and he said correctly, there will be hundreds of, if not thousands of PhD theses, and these PhD theses are going to try to create quantitative matrices to figure out post hoc if what we did was correct or not. I guess I find this a very I think this puts a bit too much faith in quantitative reasoning, let's say, and I prefer humanistic reasoning, particularly in a crisis like this. I don't think that you can put my 15-year-old developed an eating disorder because of anxiety into a matrix and weigh it against an 87-year-old not seeing their family in a nursing home, or that 87-year-old contracting COVID and dying. I think you get into a lot of apples and oranges problems. And to me, there's no supercomputer more powerful than the human mind. So the public health approach that I would have liked to have seen would have been to educate folks and say, this is your risk of COVID. COVID is very serious. If you bring it home, your family could die of this. But it's not, in my view, for the government to say, therefore we are ordering you to stay in your home. Because the government can't, on a case-by-case, it just doesn't have the computing power on a case-by-case basis to say, this is your likelihood of getting COVID. This is your likelihood of transmitting it. This is the likelihood that you'll transmit it to a family member who will die. This is the cost of losing your job. This is the cost of canceling your father's funeral. This is the cost of canceling your wedding. This is the cost of your child not being in school. I don't think we can quantify those things. And it is a fact that so far, we're a year and a half into this lockdown style approach, and there is no convincing evidence that jurisdictions that have pursued strict lockdowns did any better than ones that haven't. So you can cherry pick and say Florida has been relatively lax, California has been very strict, and even though California is a younger, healthier state, they had roughly equal COVID outcomes. Similar arguments can be made about the UK to Sweden or Chile to Brazil. But every time that all of this has been kind of quantified on a countrywide approach, it has not been proven at all convincingly that the lockdowns actually achieve what we hope they would achieve. There are some papers that model, but I mean, these models can be criticized in many, many ways. In terms of actual body counts post hoc, I've not seen anything to convince me that countries that pursued stricter policies actually did better. Just with respect to COVID, that's before you even consider the cost benefit of all the other things the lockdowns might have caused. I just keep coming back to human rights. It is the case that we all had pandemic plans, like Dr. Grant mentioned. These pandemic plans did not include generally shelter-in-place orders, certainly not for a pathogen with a mortality of less than 1%. This is something that was really promoted by China. China kind of led the way on these policies, and the democratic, freer societies of Southeast Asia, so Japan, Korea, Taiwan, Singapore, they did not pursue lockdowns with this stringency, and I'm still confused as to why we followed China's lead rather than those countries. And no single country has done better than Taiwan with respect to COVID deaths. Sorry, that's a bit of a rant, but there you go.
Dr. Grant.
So I'm just going to go back and address the question as I understand it, which is, do lockdowns work? And I will echo what Dr. Strauss said, in that we actually really don't know. We don't have enough information. So I'd actually like to reframe the question and ask the question, how will we figure out whether this was a good strategy or a poor strategy? And I think because what's happened is politics have become so engaged in this discussion that if you're, pro-lockdown, you're a Democrat or Liberal or NDP or however we want to frame that in the Canadian context. And if you're not against lockdowns, you must be some, right-wing nut job. And I think it's much more complicated than that. And we need to really step back and have some sort of assessment of how we're going to assess this objectively. It's funny because I had also written down Florida and California, but comparing similar areas that have had strict lockdown and not strict lockdown, there does not seem to be a signal that these are as strong as or as effective as we think they were. So I think the jury's out, and what I would hate for us to do is to not do the postmortem and really understand if this had any benefit whatsoever, because the risk is that we start doing this for every flu season, that we become a society that is so terrified of normal life that we don't ever get back to it. So that's sort of my big fear from this. And what we really, really, really need to do is understand the confounders of all of these data. There's seasonality mixed in, there is population density mixed in, there's the age of the population, health status of the population that really need to be considered before we come to any sort of conclusion about this. So my belief is that I suspect these things aren't as effective as everyone thinks they are. That's a belief. And we need to move from belief to knowledge.
Okay, yes, thank you. Maybe we could talk a little bit about vaccinations as well now. I think it's sort of well established now that, Canada was sort of slow off the mark with vaccinations. They seem things have picked up since then. Depending on the politics of it, there are people who point out that there's a large proportion of Canadians that now have one dose, but we are still lagging considerably when it comes to people with two doses. There's also been a debate about whether the strategy of maximizing people who received the first dose was the right move, or should they have focused more on 2 doses for high-risk individuals. So I just wanted to get thoughts on, whether, Canada's performance overall on vaccinations, and whether specifically the strategy of maximizing the first dose was the way to go. Maybe start with you, Dr. Strauss.
This is rather more in Dr. Grant's wheelhouse than mine. I think I'm an ICU specialist, so I'm certainly not a vaccinologist. I think in the postmortem, why was Canada slow needs to be taken seriously. There's been finger pointing, I think, but I've not seen, and I'm not somebody who manufactures vaccines. I don't know how to run a vaccine factory, but so those kind of supply management experts need to take a good hard look at why we got caught ultimately with our pants down for the first while. I'm really pleased that we've caught up. I think that, again, this is not my specialty, but I think it's my back of the napkin calculations that it's kind of an 80-20 rule. It seems like you get 80% of the benefit with one vaccine, so better to have twice as many people 80% covered. So that makes sense to me, and And so I've not found that part too contentious myself. So I've been happy to go along with the people who study vaccines more in a more specialized manner have said.
Dr. Grant?
So thank you. Yeah, I would say that the single dose strategy is an unmitigated success. And it realistically, in retrospect, was the smartest move. If you look at Quebec, which I think we certainly had the hardest first and second waves, they were the first to take that strategy, and their death rate in the third wave just plummeted. They did not get that second wave of deaths that the rest of us did, presumably because of that vaccine strategy, although there is an argument that sort of population immunity might have helped them in that context as well. And as you said, it's simple math. You get 80% of the benefit in that first shot. So getting across the board 80%, at least for those people who are at high risk for disease, makes a heck of a lot of sense. Where the complication comes is, now that we've done that, what's the next smartest move? And I would argue that the next smartest move is probably now getting second shots for those very high risk people. Our people in the 70 and over age group are very vulnerable populations who are very, very high risk for disease, before we start getting into very, very low risk populations for whom, vaccine or not, they're going to do super well, even if they do get COVID. So, where that line is, whether that line is at 30, 20, that's up for some debate. And there's probably people who know more about this than I do who can sort of talk to that. But once we've got that broad population coverage for the very high risk with one shot, I think we should go back, do our elders, do our medically vulnerable people, get any young people who are medically vulnerable as well. But that should not be our first priority.
Okay, and just keeping quickly with the vaccines, I could ask you as well, Dr. Grant, in terms of vaccine hesitancy, from what you've seen, I mean, are we going to start bumping up against a percentage of the population where it's going to taper off? Is that a problem? And if so, what are the appropriate tools for government to to encourage higher take-up of vaccines?
So, the good news is that as soon as you hit about 50% vaccine coverage, your rates drop. So we do not need to target 100% vaccine coverage across the board to get a really good effect from a public health point of view. So that's really reassuring. So if we do hit populations that aren't willing to be vaccinated for whatever reason, I think that we probably do more harm than good being coercive about it. And in fact, vaccines should never be coerced. I'm very pro-vaccine. My kids have every vaccine known to man. But forcing something on somebody that they don't want is not a winning strategy. And there's all sorts of psychological research looking at this, saying that the harder you push, the more resistance you get. So we have enough uptake with voluntary vaccination that I think that by all means we can educate, and sometimes tincture of time is all that's needed. If people see that after 5 years of vaccine, your arms don't fall off, then people will feel a lot more comfortable. Those people who are a little bit reluctant now, if we start coercing them, if we start saying, well, you're not going to be allowed to do this, that, and the other thing without a vaccine, and something unfortunate happens, that's going to be the analogy on Twitter that gets all the play, and that's going to work in our disfavor. So education, encouragement, and I think that's where we stop. And the good news is that even with not 100% coverage, we're still doing really well on reducing cases.
That's great. Anything to add to that, Dr. Strauss?
I would only reiterate my strong agreement with everything Dr. Grant said. And just to say, as a clinician, the psychological research you mentioned is borne out in real life. So my specialty is putting folks on life support. And I would never do that without somebody's explicit consent. And likewise, sometimes I have to have very difficult conversations with people about taking their loved one off life support. And I would never do that without their explicit consent. And as soon as I let folks know that I'm not going to do this without them, once you get someone's back up against a wall in terms of their personal health or the health of their family, it really, really becomes an uphill climb to get maybe the best outcome for them. So I'm very much in favor of a non-coercive strategy. I think we'll end up with far more vaccines in arms that way.
That makes perfect sense. Maybe we'll switch gears a little bit here and talk a bit about the economic recovery. Obviously, the economies, not just in Canada, but around the world, have been battered pretty hard by this. We've heard over and over that there can't be economic recovery until the health crisis has subsided. However, we want to define that. So I wanted to ask you, Dr. Mintz, about what you foresee in terms of the economy, both Alberta, Ontario, or perhaps Canada more generally. What are our prospects, and are we going to see a relatively rapid recovery? Is there pent up demand, and it's just a matter of putting people's minds at ease and getting them back out there to spend and travel?
Well, first of all, I think we have to remember that we really have different parts of the economy that has been affected quite differently by the pandemic. So parts of the economy has fully recovered, and in fact, some parts are even doing better than they were before the pandemic. So, for example, if you're in the area of technology or in warehousing, because of the digital economy, there were some sectors that actually are even better today than they were before the pandemic hit, and have seen huge growth in their demand, and they're employing a lot of people. We've also seen complete recovery or close to complete recovery for a number of sectors, such as manufacturing and construction to a large extent, and so and finance. And so there's not a lot to worry about, with respect to those. And of course, public administration wasn't affected very much. Not many civil servants were fired during the pandemic, and so not many had to be hired back either. The real impact in terms of lost jobs and that are going to be more difficult to come back, and that will depend really on consumer preferences down the road, are things like entertainment and retail trade, which the person-to-person retail trade side, and accommodation and travel. I think a lot of travel will come back on the personal side. It will be interesting to see what happens to business travel, because I think a lot of people found that using video conference was a huge savings in terms of time taken to go see people. You didn't have to jump on an airplane, run to the place for a few hour meeting, and then fly back. That was your whole day. Now you just do it on video conference. It's a lot easier. So I suspect business travel is going to be somewhat impacted on a long-term basis. And I can also see that there will be more flexible working hours in people not going downtown, especially in large cities where they can save on their productivity by working at home, or at least some of the days working at home rather than going downtown all the time. There is still value to seeing each other on a person-to-person basis, but we'll have to see how that works. And then some businesses have to work on a person-to-person basis whether it's in healthcare or it's in education or it's in a number of other sectors like manufacturing and mining and oil and gas. You have to be where the business is, and so you're going to have to go into work. So it's going to be a mixed response, but I think the thing to understand is that we are probably going into a period now of some structural unemployment. In other words, there are a lot of people that were temporarily unemployed and being able to get back to work, and they will do so once there are some people not going back to work because, well, they have some government funding that allows them not to work, or more importantly, are very concerned about the risks, the health risks, and they're not going back to work for that reason. But I think that's all going to get over very quickly, and the recovery will come back. And I think the bigger issue is going to be making sure that we set up new opportunities, or to help those people that cannot go back to a job they once had, that they can get the training and the opportunities to go into other fields as a result. And I think that's going to be the bigger challenge, I think, for governments, and that's going to take a long time. But you can't keep throwing at the economy more fiscal stimulus and monetary stimulus to do that, because that's just going to push up prices. Instead, this is going to be long-term policies to help people get back to, or at least to change their work life into something new. And I think that's going to be important. Right now, a lot of businesses are feeling shortages of labor. In fact, in Alberta, I'm hearing continuously from the oil and gas sector shortages of labor, and that's partly because many people who were in the industry decided to retire and they're not going to come back. Some have already moved to other places where maybe the future of oil and gas look better than compared to Canada. And it's also the fact that people are not traveling across the country in order to take up a job in Alberta as they have been doing. So there's real shortages out there, and I've been hearing that from a lot of sectors, even the high tech sector and others. So I don't think that recovery is going to be a big problem. I think it's going to be more dealing with some of these leftover long-term issues that we're going to have to deal with on a permanent basis.
Great. Yes, and you make an excellent point in that. Speaking of the economy, as a homogenous thing is probably unwise, given that there's such different impacts. I know that as someone who has to convene these panels, it's much easier to get folks on virtually than to get us all together in the same room. We've want to talk a little bit about schools. You've all touched on schools a little bit in your earlier remarks. I'm a parent of elementary school children here in Ontario. They have lost, I think, 40 to 50% of 2 years of school. I'm fortunate. My girls do okay with virtual schooling, but many do not. We've all heard the stories about children that are not just doing poorly academically, but have a host of other issues. And so, I wanted to talk a little bit about that impact and, whether, in Ontario in particular, where there's been such, schools have been out for so much longer than anywhere else, whether this was really necessary and how, I guess specific for you, Dr. Strauss, what you make of the Ontario government's arguments of the need to keep schools closed.
So it's been clear, I want to say for almost a year, that schools are not the major driver of community infection rates. So it doesn't make sense to close schools on that basis. What I have found in terms of talking to folks is that there has been a lot of fear promulgated by let's say, I won't call anyone out, but by different media institutions, let's say, where folks are honestly just very concerned for their kids' health. And I think that's not borne out in the data as well. So tragically, every year in Canada, about 100 children under 18 die in motor vehicle accident, and something like 20,000 are injured. We're a year and a half now into this pandemic, and tragically 11 children have died with COVID, and it doesn't seem like it will be confirmed whether they died of COVID or with it. As far as I have seen in medical case reports and also in news media, those children who tragically have died with COVID were usually extremely, extremely ill. So every child's life is precious, of course, but I think putting into context that 10 times as many Canadian children die in motor vehicle accidents every year, and we have come to tolerate this, frankly, unacceptable risk, I hope would just put things into perspective. And that it's my honest belief, it's not belief, it's borne out by the data, that if driving children to school is more dangerous to their lives than the chance of them getting COVID at school. The benefits of education and of socialization hardly need to be described. So I think it has truly been a wrong decision to close schools. I have significant concerns about the influence of teachers' unions and lobbyists on that decision. So recently our premier asked for scientific consensus on whether schools should be open or not. As far as I can tell, he received very clear scientific consensus that schools should be open, and yet schools remain closed. And that decision hasn't really been well explained or rationalized to me. So that would be my position there.
Dr. Grant?
I'm on record for being very strongly pro-school, and it's because, as we've said, schools don't appear to be associated with worse community spread. And I do actually really want to point out to people that if you compare Ontario and British Columbia, we had our schools open the entire time. They have not closed since June of 2020. They have gone according to rock solid schedule, exactly as they were supposed to. We have fewer cases per capita and fewer deaths per capita than any of the other large provinces. So the argument that schools are associated with worse community outcomes is flat out wrong. What is clear is that not providing school for children causes untold harm to children and families. And we will not see the end of that for decades to come, because every one of these kids that has been harmed is going to have that as part of their persona moving forward. And the excuse that kids are resilient needs to stop. Yes, some kids are resilient, but enough aren't, that this is not an excuse we should be using. It is our fiduciary responsibility to care for our children. Children have a legal right to education, both nationally and due to the International Convention on the Rights of Children. Schools should not close until such time as it's shown that going to school is harmful to the children themselves. We cannot use children as shields for adults. It's wrong.
Okay. I have a couple questions here now also from the audience, mostly medical questions, but Dr. Mintz, maybe you can weigh in on any of these if you have any comments. I had a question here from Georgianne who asks about incorrect attribution of deaths to COVID. Is this a significant problem? You know, we've heard about the difference between dying of COVID or people dying with COVID. Is this a significant issue in terms of counting deaths? Is this captured by excess mortality rates, or is this not a very large number in the grand scheme of things? Maybe start with you, Dr. Grant.
So yeah, and that's an incredibly important issue. And the honest truth is we don't know 100%. There are clearly people who die with, not of COVID. Unfortunately, often in cases, it's incredibly hard to tease out the precise role. And many of these are people who are teetering on the edge, and had it not been COVID, it would have been something else. Having said that, there are legitimately otherwise healthy people who are not teetering on the edge of anything, who have become ill and unfortunately died. So it's a mixed bag. And what we actually really need to do is go back to charts and do a really good chart review and try to assess that. It's not an easy thing to do, to pick up from statistics, because it's really complicated. Even doing chart review is really complicated. What I can say is in the case of children, we have done some of that work, and only a third of children admitted to hospital were admitted because of COVID. The other 2/3 were either in a hospital for other reasons anyway, or were just sort of pushed over the edge on a chronic condition. So 2/3 of children who have hospitalizations on record, which is already quite low, had nothing to do with COVID. It was coincidental to their admission.
Dr. Strauss?
I think I'd say something similar. So I believe in Canada, in general, a COVID death is a death within 28 days of a positive test. I think that's kind of the asterisk explanation on the Canadian federal government COVID dashboard. Just in terms of like how the sausage is made, like physicians are often filling out death certificates and they don't really know what the cause of death is. So if somebody has advanced stage cancer and heart failure and dementia and pneumonia, and they're in the ICU, and their heart suddenly stops at 3 a.m, and a physician has to fill out the paperwork to say what they died of. You can chart review that later. You could have a coroner investigate it later. You could have an autopsy later, and all three of these extra examinations might arrive at a different conclusion, because ultimately the cause of death was all 5 things. So I think it is clear that there have been cases where the person died with, not of. But this goes back to the quantitative versus humanistic reasoning issue. I don't think we're ultimately going to get a hard statistical answer as to what proportion of each we ultimately experienced. Okay. I'm going to take one more question here from the audience, and then I'll sort of put a broad final question to everyone, and you can wrap up with some closing remarks. It's a question about harms like overdoses and suicides. I mean, we talk a lot about mental health and sort of these unquantifiable harms, but these are other deaths. To the medical doctors on the panel, is this something that has received enough attention?
in the discussion about the trade-offs, and are the numbers significant? I mean, I've heard conflicting things about whether suicides are up or down. So maybe you could shed a little light on that, Dr. Grant.
So yeah, it is a huge problem, and I think we really need to put things into context. First of all, that yes, we don't get up in the evening news every night and say how many people have died today. About 777 people die in Canada every day. In a non-COVID period, people just sort of die. So we really have to understand the risk in that context. Sorry, can you just repeat the question? I've got off at a tangent here.
It's just about whether suicides and overdoses, have they got enough attention, and is it a very serious problem?
Yeah, and in BC, certainly during the first wave, and I haven't seen from the second and third waves, but our overdose death exceeded our COVID deaths. So that's well documented. It's on all of the BC CDC websites. So absolutely, there is all sorts of things that are balancing that we have a hard time recording. The issue about suicides is the problem with suicides is the damage done now is likely to result in a suicide 1, 2, 3 years from now. It will be related because of job loss, financial issues, divorce, whatever it was. But it's not going to get counted and it's delayed. And so it doesn't enter into that math that is being put up in the nightly news.
Dr. Strauss?
Yeah, it's certainly a problem. Again, the issues with quantifying that problem abound. I think in the United States, the opioid death rate had gone up by about 50% last year. They seem to have faster statistics than we do. I was speaking with a regional coroner the other day who said that our rate is certainly up. His view was it had to do with folks using alone, whereas they used to use opioids in more of a party atmosphere where somebody would call 911 when they were unresponsive. It is my unquantified clinical experience, just in terms of even the folks I'm seeing in clinic. There is more stress, there's more anxiety, there's more substance abuse, there's more hopelessness. So whether suicides go up now or whether they go up later, I'm unfortunately fairly sure they're on their way up. And then the other, this is tangential to the question, but the other thing I've been seeing so much of lately is advanced stage cancer that didn't get picked up through either usual screening or folks thought, hey, I have a lump here, I'll call my family doctor. The family doctor does telephone visits only at this time. I've had multiple patients with that sort of story who show up in hospital in extremis and die of stage 4 cancer sort of within a month. And it's all tragic and heartbreaking. And I think largely some of it could have been avoided.
Okay, well, thank you. So, I mean, as I said, I'll just sort of put a broad question to each of you, and then we could start maybe with you, Dr. Mintz. Just, we now have been in this, more than a year, about 15 months. We have the benefit of some hindsight now that we did not have 15 months ago. And, maybe to put a more positive spin on it, since most of the news of what we talk about is bad, is there anything that you think we have learned from a policy standpoint that you think that could be applied for the next pandemic that we could have really used this time, but we did not learn it in time? If there's one thing that you would really like to see, governments stick to or abide by in a similar situation in the future. Start with you, Dr. Mintz.
Well, I'm actually of the view that I think we almost need a commission to kind of look back and see what are the lessons learned and what are the things that we could have done better. I think that's really part of the problem right now is that, when I look at what we did, I'm just not sure we did all the right things. And there were a few things that I think were very important. I think because it was a supply shock to the economy, that, governments really came out and supported the household sector to make sure that people didn't go bankrupt and lose their homes, etc. We would have had more social stress if that happened, and economic stress. So I think that was a positive thing from that point of view. But did they go too far? Did they spend too much? I mean, that's a question I think we have to answer, because household income actually going up 10-12% in Canada, when in Germany kind of was just flat. I think we have to ask the question whether we went too far down the road. The same thing with pharmaceuticals. We didn't talk about that very much, but people talk about the lack of manufacturing capacity. But we've had declining pharmaceutical investments in Canada over the past decade. Why is that happening? We also have new rules that are coming in on pricing that could discourage pharmaceutical companies from being here. And then we've also potentially are making the wrong bets, or maybe we're making the right ones. For example, we're putting money into Novofarm, but maybe what we should be doing is putting money into the new messenger RNA type technologies. Maybe this is going to be the technology of the future. I'm not an expert in this area, but I think that's the kind of questions that we should be asking in terms of what we're doing and whether it's making very much sense. And then I think the third thing, which I think is for the future, is to understand what this means to the way that people are going to handle themselves. We talked a little bit about that, but I didn't get a chance to say much about the social side. But part of it is because I have been involved with a number of people, including talking to social workers, etc. Just because someone doesn't commit suicide doesn't mean they're not suicidal. Those are two different things. And suicidal people have gone up a lot. You talk to social workers, they'll tell you how many more people have been expressing suicide. And they don't necessarily commit suicide in the end. But there's so much stress out there. And then when you look at the education system, we have now, what we forget about is those children that have problems, learning disabilities or deficiencies. They did not handle online very well. Young kids did not handle online very well. So there are a lot of kids that did suffer, I think, in terms of their education. And so the question is, what are we going to do about it now that we're going to be coming out of COVID? How do we handle that? What are we going to do for those kids? How are we going to help them get along? And I think educators are going to have to start spending some time on that very soon. So there's a lot of things to learn, and there's a lot of things that are new problems that we're going to have to deal with very quickly.
Thank you. Dr. Grant?
Okay, thank you. So my number one was going to be don't close schools, but since we've sort of hammered that one to death, I think the things that we should be much better at next time is to have clear goalposts and to stick to them and to not constantly move them. I think half of the stress was the uncertainty about when we're going to get out of this. And tied to that is the unending clinging to a goal that clearly is not going to happen. So we have a number of people who keep saying we're going to get to COVID zero. We are not. That ship sailed. It probably sailed in January before we even know we had a pandemic, because we're finding specimens in sewage samples that had the virus in January in Europe. Everyone wants us to be like Australia. We are not Australia for a number of reasons. And certainly it may have been reasonable to try once, but when it becomes increasingly obvious that that's not going to happen, as you quixotically go after an unattainable goal, you just accumulate harm after harm after harm. The other thing that I think we really need to look at, and this sort of ties into Matt's concern about human rights, is using coercion, using law enforcement, and on a less sort of government-based method, shaming for people who, for whatever reason, can't comply with what's being asked of them. People aren't trying to be nasty for any reason. Some people have legitimate reasons that they have to do things that may not be permitted by the government. And unfortunately, the government's one size fits all, you must do this, is not functional for a lot of people. And I think the last thing that I think we've learned from this is that outdoor space and outdoor recreation is critical. It keeps people healthy. It keeps people happy. And so denying that has been, I think, a big mistake, and one we should not repeat. People should be allowed to go outside, to go to parks, to play games, to have that outlet. Because if people are locked in a house with no hope of ever getting out, that's when we get into a lot of the mental health issues that can be mostly, or at least somewhat mitigated. And that needs to be made available for all people, not just the people in Forest Hill who have access to nice parks, but the people in downtown high-rises, there needs to be park space. There needs to be a way for people to get out. We need to not have stay-at-home orders, but rather get out and play orders.
Dr. Strauss.
I think I have three things I want to touch on briefly. Fear, holism, and the state of the public discourse. So at the beginning of the pandemic, I started publishing some things, mostly in Spectator UK, about how I viewed the pandemic and what our response should be. And I received some blowback from acquaintances of mine who were saying, no, you can't say things like this. You can't minimize, the World Health Organization was publishing like a 3 to 5% mortality rate. And I was explaining how it's probably something closer to 0.5, which turns out to have been valid a year later. But I had blowback from folks saying, no, we have to, if you don't scare people about this, they're not going to do what we say. So we have to keep them as scared as possible. And I could scarcely believe that physicians of my acquaintance were writing this down on paper and sending it to me in an email, that they thought fear was the best public health maneuver at the time. I don't think that's true. So I would like to see less promulgation of fear, both from, let's say, official institutions as well as the media. What was the next thing I had said? Holism. So holism, unfortunately, has become associated with, let's say, alternative medical practices that are not evidence-based. But that's not what the word means. The word means understanding the whole person. The World Health Organization has a much vaunted and I think valid definition of health, that it includes your social life and includes spirituality and includes exercise and connection and being able to, and fitness, not just absence of illness. So the next time we have a pandemic, I would like to see the risk of a communicable disease weighed rather more against all these other aspects of health, let's say. The last thing that I have truly been shocked by, I was the most, and I still consider myself to be the most mainstream physician. My training is in science and medicine, and I'm a critic of, let's say, crystal healing and acupuncture and these things. And I'm a professor or assistant professor at a well-respected university. It's been shocking to me the amount of blowback I have received, both from my writings and from my tweeting and the interviews I've given from folks who have frankly been choking with rage that I have a different opinion about how we ought to have gone about things. And I just think COVID is a peculiar pickle. Humanity's never been in a pickle like this before. And the way that we get the best public policy is by having well-meaning, well-educated people hash it out in public. And that's where you get the best ideas. And so I think, much has been written and said about cancel culture and Overton windows and these things. And I think we've done our society a lot of harm by not having the most open and frank discussion that we could have had in public. So thank you to this institute for hosting this sort of thing. So I think this is really important. I've had particular views on lockdowns. Dr. Grant has had particular views on lockdown. I think I've been involved in 2 debates over the last year and a half, but in general, the folks who've been making the policies have not been interested in debate. So I'm really happy for this sort of forum, and I hope next time around we see more like this.
Well, thank you very much for that. It is our pleasure to host all of you, Dr. Matt Strauss, Dr. Jack Mintz, and Dr. Jennifer Grant. Thank you all for participating today. It was a fascinating discussion, and I'm sure that folks watching this have learned quite a bit today. So thank you all. And for all our viewers, enjoy the rest of your day.